Our next speaker is Dr. Rajiv Jayasena. Rajiv is the Group Leader for Health System Analytics and the Victorian Lead for the Australian eHealth Research Centre, which is part of CSIRO, the Commonwealth Scientific and Industrial Research Organisation. The Health Systems Analytics area includes research on hospital patient flow, operational productivity, statistical simulation and modelling, risk forecasting on health service delivery systems, and mobile health models of care for rehabilitation and chronic disease management. Rajiv is also manages the clinical trials in primary healthcare reform nationally and leads new areas of science in response to research opportunities and stakeholder priorities. Please welcome Rajiv.
Thanks, Rosa. Let me start by good afternoon, everyone. I would like to acknowledge the traditional owners of the land where we are meeting here today and pay my respect to their elders, past, present, and future. Get this going. There you go. So, for the people who don't know CSIRO and people, the international visitors, we are the science agency in Australia, and we have a large we are a large research organization, but a very diverse research organization with portfolios ranging from farming to space to environment and many others, and health, obviously. Health is national, so we work on national challenges, and health is obviously a national challenge due to the aging population, chronic diseases are on the rise, and of course sustainability is a big issue because health spending is going up by the day. At CSIRO, the National Digital Health Research Program is called the Australian eHealth Research Centre, whom I work for. We are a large digital health research hub established about 15 years ago with about 100 researchers and about 30 students, mainly postdoctoral and PhD students within that 30 group. And we are nationally, our footprints now nationally with a very diverse research group, again with engineers to statisticians to medical researchers to clinicians. So we are again a very broad group. So my talk is about, it's here too, very good, is about technology-supported integrated care, where I will briefly discuss several case studies, which are technology-supported care coordination models, and these are trials that we've done in the last several years, and mainly talk about their learnings and challenges, obviously, followed by a program that is mainly designed to encourage this kind of out-of-hospital care, and I'll talk about a bit of the drivers in that particular new program as well at the end. So several case studies, as I said, very briefly I'll touch. So first one is the National Telehealth Telemonitoring trial that we did some time back. These are all published. Most of them are published. So in this, we actually had about 6 trial sites which we started with, right across 5 different states, but obviously that changed very quickly to 5 trial sites due to change management issues and implementation issues. It ran for about 18 months. Mainly it was care coordination, where the coordinator would remotely monitor the patient and orchestrate the appropriate care, which might be coordinating with your GP or home nursing, or just talking to the patient and adjusting their care needs. So what happened? I went the other way. Yeah, that's right. So from this 18 months or so, mainly about 12 to 18 months, most were around the 18-month mark, the results are very compelling, where we demonstrate the impact on primary health care and acute health care cost savings. So mainly this was to do to look at Australian evidence here to see what was the impact on sustainability and healthcare costs. So, the other good thing was it had very good acceptance, and it showed the patient cohort was rather elderly, but yet it had very good acceptance within that cohort. Next case study that I will briefly touch is about a home monitoring program for chronic heart failure, which we call the enhanced model of collaborative care. They're basically a Bluetooth-enabled weight monitoring device which collects the data based on the care plan of chronic heart failure patients, gets uploaded via an app, which is a tablet that is provided to the patient, and then several alerts are developed, come up based on the monitoring, and it goes to a call center as well as a care coordinator. And there were some of the low-risk alerts. Even we had an automated sort of questionnaire which came to back the patient, just to enable the patient to make those decisions as well and understand, how they need to be managed. So that develops more on the self-management side of things. Results from this randomized controlled trial showed clear improvements in weight monitoring compliance. Our primary outcome was to look at compliance and of this enhanced care group, and based with the controls, as well as improved health maintenance, diet, and medication management. This work is quite close to be published. It's currently being written up. This particular study was mainly it was a randomized control study for cardiac rehabilitation. This was our very first study we did about 8 years ago to look at the impact of home monitoring, home-based cardiac rehab. Currently, cardiac rehab is done through a center. So we enabled the mobile phone and mobile health platform to see whether you can do the program, the 6 or 7 week program, from the home with a mentor from the hospital. So again, we looked at adherence, completion, and so uptake, completion, and adherence, which all three components were improved. And not only those were primary outcomes, we also looked at some clinical outcomes, which demonstrated 6-minute mock tests, weight and blood pressure. There were indications that changed as well, which is really good. So this work has moved on to there was a company formed, and it's been spun out at the moment, and it was published extensively as the first RCT that was using a smartphone for rehabilitation. The next study I would just want to touch here is the work we have done, a feasibility study more so, looking at gestational diabetes. Young moms, to manage their gestational diabetes, you probably are aware, you have a notebook, you record blood glucose readings, activity and diet, and then they need to bring that to the appointment, and most of the time they forget to bring it or even to write certain things down. So we enable this more using a mobile health platform, and the information most of the time gets uploaded automatically. The feasibility study shows very good results, that early intervention was enabled, as well as the reading changes were detected, and the app was very user-friendly, as well as it enhanced clinical collaboration, which was the key. So from these studies, presenters and several other trials we have done, which I haven't talked about, many other common challenges and learnings which are outlined in this study, in this slide, and I'm not, sorry, the busy slide, I'm not going to go through everything, but I will highlight a couple of them. One of the key things we need to understand is interoperability is very important and can cause issues if it's not thought out correctly. And even simple things like Bluetooth connectivity, 3G, 4G connections, and sometimes connecting with the GP systems. It's quite important because it impacts the sustainability after that. Training is one of the key things. We need to resource these things properly, as well as make sure that the clinical staff and the people who are doing the coordination are well trained, as well as you manage their change management as well. Make sure that those kind of material is available if they move on or people aren't there. And also one of the key things is you need to give good thought to data security and privacy, because that kind of things can actually make or break your trial, because you lose a lot of trust. One of the other things as well, you need to think about, in an enabler side of things, how can you provide decision support for people who are looking after a large group of patients. So, using artificial intelligence or alert programs and things like that, algorithms and things like that, which you can actually, some are already available and tested. From the enablers, mainly, one of the most important things is executive support, as well as frontline staff need to hear the communication and that message clearly. So that's a very important thing. So, so the holistic approach to patient care is also very important. Because most of these patients not only have one condition, they have comorbidities and as well as complex patients. So importantly, that's the sustainability of successful trials. They need to have well-funded or clinical champions to support their existence beyond the trial period. So one of the things, this leads to my next few slides, where a novel flexible funding approach is tested in Victoria. So I'll just talk about that. That's mainly to facilitate beyond bed-based or hospital care. So this slide explains the program, but which is an integrated care through flexible funding called Health Things program, provides hospitals with the ability to convert activity-based funding, which is the way the hospitals are funded, for patients who have complex needs, which can be provided through out-of-hospital care. So algorithm is used to identify patients with high risk of future hospitalization, and a range of approaches are deployed to provide them with more coordinated care in the community that they live. So the next couple of slides, I'm just going to touch on a couple of these. These are some of the themes that are arising from the focus groups that we are conducting as the evaluator for Department of Health. So the participating health services, there's several, and the findings, there's a lot of overlap with what I've talked about already. But such as like leadership support, having proper training and communication programs in place, and having that buy-in from the frontline staff, which is very important, because things won't really get done if that's not clearly happening, as well as mainly the responsibility allocation should be actually well understood at the start. Etc. But I'll focus on three areas mainly, as one here, which is patient-centered care, mainly individualized and holistic, accommodating diverse needs, need to be incorporated in a care program, but need to be mindful that some of the elderly patients might not answer your phone calls, or might be other difficulties like dementia and so forth. Would introduce challenges. So the intervention should have a system-based approach, is the other thing, for sustainability, and be integrated with other systems. However, the need to need to plan well to minimize competing other demanding projects and other activities that are happening at the same time, because you don't want to have many projects happening at the same time. So those are challenges that you have to manage. The other very important thing is benefits need to be communicated to carers and clinicians, because it's very powerful to hear about the good things that's happening to your patients. However, However, you need to be able to collect good data, but the key is access to the data should be also available. So those are some of the challenges that you have. So in essence, this comes to my last slide, where of important aspects of implementing technology-supported integrated care into routine practice, which requires a pragmatic and a learning culture. Otherwise, it won't be embedded well. Where organizations are willing to try, change, adapt evidence-based care models into routine care. However, in implementing these care models, it is important to prioritize patient safety and well-being and staff well-being during the scale-up phase, because you need to constantly be checking in with those. Furthermore, it's an incremental scale-up plan underpinned by a well-designed evaluation framework would enable the learning health system where you can actually have those feedback loops, which is basically to realign, train, develop staff, and the encourage ownership of the frontline staff, ability to manage funding, sustainability, to maintain expectations and increase the successes. That's about it. Thank you. Any questions?
Thank you, Rajiv. Now I'd like to open questions.
Thank you, that was very informative. The first example that you gave around the care coordination remote monitoring, has the results of that been published?
Yes, it has. This is the National Telemonitoring Trial.
Yeah.
Yeah, I'm happy to send that through if you just send me an email.
Thank you very much.
No problem. There were several papers published, but the main results paper is also published a couple of years ago.
Thank you. I think that one of the issues is that we're using telemonitoring and other innovations to try and turn a huge ship around, because I think that what has become apparent over the years is that somehow or other the health services are going not always in the wrong direction, but not in the most optimal direction. So one of the challenges is bringing innovation in and resistance, which is natural. And sometimes it's very threatening, and it threatens power relations. So it's really, to really make this system transformation, as you said, it involves top down and bottom up. So I think that's one of the key messages. If the innovation is threatening and challenging, but actually we have to do it because a lot of our processes are not fit for purpose. So I just wanted to support what you said.
Absolutely.
Do we have any other questions? No? Please thank Rajiv.
Oh, thank you.